Good afternoon and welcome to the conversation. My name is Shaligan Peterson. Now, this afternoon we delve into the informal economy. As we know, it has been one of the hardest hit when the pandemic hit the shores of Namibia. One of those within that economy is the shebeens. Now, as we know, they have been put on and off, but mostly been on the off side. If it's not off consumption, off-site consumption, and not on site consumption, where they currently are. Now, in studio, we do have one of the owners here, Faniel Haidua, who will explain to us and give us an insight on how COVID-19 has impacted the shebeen owners. And just recently, they had written a petition to government asking for some relief and allowing on-site consumption. We also have Dr. Kavetu Sikuvi, the head of the COVID-19 case management task force, to help us understand more the science behind how the virus moves and how areas such as shebeens that are not mostly well ventilated and how the virus reacts in such an environment. Thank you very much for joining us, gentlemen. Faniel, we'll start with you. Let's just go back to how was the shebeen business doing before COVID-19?
The shebeen business have been a normal business as we have started, some of us, long time. So we were doing fine.
Remove it. Sorry, please remove your mask. Sorry, yeah.
We were doing fine as informal and formal businesses. And as I'm speaking on behalf of Oshisho Formal and Informal Business Association, currently I'm not in the position of those who gave petition to government. So by under this umbrella, I'm just
Pleading with government.
with government.
Yeah.
Because petition is from sometimes strikes and is from a certain individual people. Sometimes it causes impact and chaos to our own government. No, I myself, as a chairman of the association, I prohibit it.
Okay.
But I see the impact that caused by COVID-19. COVID-19 is an outbreak to everyone, and even to the government itself. So it's unforeseen disease. We cannot blame our government, but we want to see the modalities. How can our people should be helped?
Yeah.
So because now we have been closed and open, closed and open.
Yes.
Listening to our government is fine. The government wanted to protect us, but as I'm speaking now, we are thinking if it is possible, our government put that idea into consideration.
The on-site consumption.
Yeah, to have on-site consumption, to adjust our limited hours. So now shebeens are selling from 9 to 18, which means really our customers, they are at working class. They don't buy during the day. I want to give you an example. You sell maybe 3 crates of beer before. Now you can say sell 3 beers. We are having those jukebox and sometimes a gambling machine in the shebeens.
Yes.
And people are takeaway system. So you do nothing. It's just like you are closing. We look at the accelerated of COVID-19 cases, and I just want to advise, not to advise the head of the state, no, to advise on the matter, if we can be heard, so that we can be open to normal hours like 10 to 10. And we should given an option and given a regulation that can fit, like we are ready also to protect our people. It doesn't mean we don't see that disease. COVID-19 is a disease that can kill everyone. We lost lives of people, we lost our families, and our businesses also.
Fanil, when you say you are ready to protect your customers, what do you mean?
We mean we have to organize them with that measures like sanitizers, distances. The gathering is now 200,
100, yeah.
100. And I don't think in each shebeen can accommodate 100 people, maybe 15 to 20.
Yeah.
But strictly, we are also need to help and to be stand next to our businesses so that we can oversee how the business is going with COVID-19. Otherwise, we can let our people dying and no, we are not for that
And
purpose.
that's not what you want.
But we
yes.
are feeling hungry. It's not an hidden thing. We are experiencing something huge that we are suffering. Really, we are suffering. Not because of our government, not because of who, because of COVID-19.
Yeah.
We are just requesting the government to put such a modality into consideration.
Thank you very much. Dr. Sokovi, let me go to you. With the new Delta strain, the variant actually, not a lot has been out there in terms of what its characteristics are. We know that it's a bit more aggressive. Maybe you can just tell us, how does it act? What makes the Delta variant so dangerous?
Okay. Thank you, Shelley, for the question. And thank you for having me. So let's just start. Let me just support my colleague there that Delta variant or COVID-19 has actually brought a lot of sufferings, not only in Namibia, but we have seen all over the world. There have been a lot of suffering due to Delta variant in terms of economies and also of human life. We have lost a lot of people. So that's what makes Delta or coronavirus very unique in a way that affects everyone in the world. So that being said, coming back to your question, so we know that the WHO developed this new system of naming variants for SARS-CoV-2 infection. So they use the Greek alphabet. So the current variants of concern currently in the world, we have the Alpha, which is the UK. We have the Beta, South African one, and then we have the Gamma that was isolated in Brazil, and then the Delta, initially isolated in India. So these are the variants of concerns. They mutate and create infections in different areas. So the Delta variant, it is still a coronavirus. So what we know, it has caused really devastating waves, in India and UK and ourselves, our third wave. It has been shown, to have caused 60 to 40 to 60% of transmissible than the Alpha variant. So what is very unique about the Delta variant is that it is more transmissible, meaning it is more likely to be transmitted to another person than the previous variants that I've mentioned. So in addition to the normal COVID-19 symptoms that we have seen with the original variant, the Delta also causes more symptoms like headache, running nose, and it could fool you into thinking that it is just a bad cold. But then it's, you may just say that I'm just having a bad cold or flu, while it is Delta variant. So that's why it is very important for the public to be aware of these symptoms and not to be fooled by Thank you. I submit.
Yeah, yeah. Fana, let me come back to you. You spoke about we are suffering, and you spoke about how the sales have gone from perhaps, for instance, 2 or 3 crates to 3 beers. Let's talk about
Actually,
how.
can you just speak up a little bit louder?
All right. Yes, I'll do that.
Okay.
Faniel, you spoke about the sales reducing drastically from, for instance, if we have 1 crate to 3 beers, and that is because of the off-site consumption takeaway basis regulation that we have. How bad has it been in terms of salaries being able to maintain a shebeen businesses, and how many shebeens do you know that have closed?
Currently, as I'm speaking, um, uh, let me put it that way. In Windhoek alone, the bins which is going to be closed as I'm speaking from now, they will be half. I'm speaking about the illegal one. Half of them, especially in Windhoek, which is commerce, they are around 6 to 8,000. The half is already on their way to be closed. And I understand the formal one, which is having licenses, it's going to be a quarter, and they are around 320, 330. So the salaries, say for example, you have 2 workers, and now you remain with one with half of the price that you can give, or even total closing, because if a person doesn't receive on her heart or his heart that I used to pay you 1,000, then now it's 500, he can leave. Then the business is already closed.
Yeah.
So we employ, we call ourselves a second economy from the ground of Namibia, because if I understand myself, even the brewer can testify, they will be our testimony. We are buying them like nobody's business from wholesale, the products from the wholesale, like Metro, Cash and Carry. So I think 50% of our employees, they are already lost at their work.
Yeah.
And we are already on our way to close everything. So we don't know how to help ourselves. I have indicated one day that our car is already gone, taken from the bank.
Yeah.
The houses, we are paying water bill from municipalities. We are paying basic needs. So definitely, I'm speaking on behalf of somebody's, but there we are not blaming our government. So, but we have to indicate what is happening on the ground. Yeah.
We've seen numerous times how the NBL has put out, statements saying that they are not surviving, but they are doing much better now with being able to, somehow operate. And sales of alcohol hasn't been prohibited since the full lockdown previously. Dr. Sakuvi, maybe you can just give us insights when you look at the preventing the spread of the COVID-19. What are some of the key things that you look at, for instance, when it does come to public gatherings, when it does come to, for instance, people wearing their masks and social distancing? What are some of the key things that are the little things that would help to prevent the spread of COVID-19, and that you guys consider when you do inform the policymakers in terms of looking at the third wave now that we've had?
Yes, thank you for that question. Shelley, see, prevention of SARS-CoV-2 requires really a multi-layered approach. So we know the secondary preventative measures of SARS-CoV-2, which include, in addition to social distancing, wearing of your face mask, and sanitizing, and then the primary preventative, which is vaccination. We also know that ventilation is an important part of the layered preventative approach to the COVID-19 infection. This is because it supplements the social distancing. Okay, so we know that the SARS-CoV-2 virus particle concentration is often higher indoors in an environment with an infected individual. Therefore, in the event that the social distancing cannot be observed, for instance, in churches or classroom or public transport vehicles or any place where ventilation is not that adequate, ventilation itself plays a role in minimizing the risk of infection from what we call aerosol spread. So therefore, opening of windows to allow air circulation or to supply fresh outdoor air into the space or building or facility improves ventilation and thus reduces the risk for infection. I must also just state that I am a clinician, not a policymaker. So we advise according to the science which is available. Thank you.
Yeah. Faniel, there has been, I know with the minister, when the Namibian wrote the story about the shebeen owners and what's currently happening there, he did indicate that he doubts that there will be social distancing with masks, or social distancing and the wearing of masks in shebeens. He also previously on the conversation explained how, for instance, the mask will go down as more beers are consumed. Do you think that it is right that the minister said that he doubts that there will be any social distancing in shebeens?
Yeah, yes. Currently, yeah, I can agree, but I can disagree. Because ourselves, we want also to be responsible people. We want to do business, but we want also to save lives of Namibians. We are not capable enough to control them. But as we put the structure and inform, please, every business must be responsible. The owner of the Kambashu must be responsible to do A, B, and C. If not, then we are going to be total closed because of that disease. Yeah, it's normally accommodated by our hearts. So we are just asking. And we don't want to do something alone. But if we put hands together to assist the government also from our grounds, because life, you can die by hungry, but you can die soon by COVID-19. We want a certain way, systematic. Can we do ABC so that we can save from hungry and save from COVID-19? But can we have another round of approach to educate our people so we can understand, all of us, that COVID-19 is very dangerous, and if we are not adhere to it, the government is already wanted. They really want to help us. Already we see there is an indication that the government is trying its level best, we see. But if we are not adhere to a certain function, system that the government, we need something from the government to be understood by our Namibian shebeen sectors. As I'm speaking, I know they used to understand. If you remember, there have been closer long ago, since 2012. The government put us on a certain option that if you do ABC, then we understand you. If you don't do, then we close you. They will understand. Now we are already illegal. Remember, we are already illegal. We are always request the government to assist us on ABC, but now we are already illegal, and we are already in a COVID system, so we don't know now. We don't know now. But as I'm speaking, not to blame anyone, not to blame the government. What we need something fitting our life, both sides.
Yeah. What do you suggest government should do in terms of helping you guys to operate better?
By my request, can we have our operational hours from 10 to 10, 10 morning to 10 in the evening, and from Monday to Saturday. Then we can also see how the COVID will spread again. If it is coming, we understand we will be close, but we will die. We will die serious. If you come to the location, everyone want to hear serious. And people now, they are starting blame our leaders, blame political parties, blame what? No. There should be nobody to be blamed. Nobody wanted that disease. We don't know where it came from, who created it. Maybe it's God's will, you don't know. But we will understand it. As previously, if the government announced, they put us message, then we understand. We have been closing. We are listening to our leaders. We are listening to our government.
Faniel, I'm sorry to interrupt you there. Are you vaccinated?
Not yet.
Not yet.
Yes.
Do you know of shebeen owners or shebeen operators who are vaccinated?
Yeah, many of them.
Many of them are.
Yeah, but me, I'm just waiting for maybe end of this month. I'm going to be vaccinated.
All right.
So I speak something, but under correction. No, I'm a COVID-19 survivor. I was not speaking. I was not working. So they are saying you can go for vaccinated after 3 months. I don't know. It's not a genuine story, but according to me, I'm going to be vaccinated. But we want also to understand what is downing people. Vaccinated is not having a definition. Some are saying do this. Some are saying this. Now we don't know which is west and east and north and south. We don't know. We are in dilemma. Can also the government be, I don't know, explain more? And our health professionals should intervene to make us understand. And we convey the message to the ground. Our people are listening, but sometimes they are afraid. On that note, they are now put political party on scale, which is high, or is SWAPO, is PDM, is what, is NUDO, is what. But we want all professionals, healthy professionals, should explain more so that we can convey this message to our people, to the ground. Otherwise, we are saying some 50-50. And I'm going to get vaccinated. I'm not. No, but I think I will. No, not yet. So we are just, we don't understand. Yeah.
That's why we have our health professional and expert here, Dr. Sukubi. Dr. Sukubi, if we have more people on the street vaccinated, I know we've been talking about this, will it help? Will we see the economy open better and more if more people are vaccinated? You're on mute, doctor.
Sorry about that.
Yeah.
Actually, that is really a very, very good question. Maybe let me first start by saying that what we have seen since the pandemic, it started in the West, and in the East, and then Western country caught on, and these are all high-income countries. Okay. And then their economy, even them with high income, their economy were really, really affected negatively. So, and we saw what happened to them, and people died, and they went on campaign to make sure that people are vaccinated. So, and now what we are seeing now, that, football stadiums are full, and they are not wearing masks, most of them. This is because they reach a stage where most of them are more than 60% vaccinated, which means that they have achieved what you call herd immunity. Herd immunity meaning that a stage where most of the people are vaccinated and the prevention of the SARS-CoV-2 virus is easier than when you don't have that herd immunity. So yes, to answer now the question is yes, we can get to normal, some form of normal. However, we have seen the vaccine hesitancy that has been happening. Currently, we are just about 6% full vaccination, which means that we are way far from getting herd immunity. And in coming back to normal will be difficult because we are still at risk of getting another wave. So vaccination is very important. Getting full immunity is very important. And then I want to come back to an issue of many people being in dilemma, as our guests from shebeen representative said. So, and also when is it the next time to get vaccinated after getting COVID, as he himself had COVID before. So, Ministry of Health has been working really, really hard to try and disseminate the information to the public. And we also know that there's misinformation running around in the social media and so forth. So what I would suggest is that we need to listen to the radio, NBC, media outlets that is genuine, that is promoting what the government is saying. So because the government is here to protect the people, so we should be able to, we should listen to the government, and that is the right information. So just for the personal answer is that one needs to be vaccinated 2 weeks post de-isolation from COVID-19 infection. So if you had COVID-19, and when you recover, just 2 weeks after you have been de-isolated, so you can get your vaccination. Okay? That is the answer for personally for our representative from the shebeen. So, and yes, we will get there as long as we get vaccinated, and that is the only way because COVID-19 is here. So, thank you.
It sort of makes me think that perhaps there is a campaign I know going on, but maybe this campaign should be linked to, people on the ground, such as Faniel here on the ground, who is part of the informal economy. And if we have a partnership between, for instance, shebeen owners, if we have a partnership with vendors, I'm sure that would sort of influence more people to get vaccinated and maybe more understanding of what the vaccine is, and that it will allow economic activities to continue. Do you feel like government's message in terms of the vaccination campaign is good enough? Do you feel like you feel informed throughout? I know you indicated that more needs to be done.
Yes, thank you very much. It's good, it's quite enough, but our people sometimes they are listening to what others are doing, because they are saying some they are in a position of saying listening to hear and say like if you get vaccinated then you are going to die after 2 years. Then the bad things are disseminated quickly, very quick. But if you put up stakeholders, including us, to advise our people working, we are having WhatsApp groups where we go to medias and inform them. Can we do ABC so that you can be maybe recovered or healed from the COVID? Then we open our businesses. Then that message should be taken. Sometimes when they listen to the radio, they say, no, the radio, they don't understand. So we want to make our people understand what's going on. some of the doctors need to be intervened. Our professional, health professional, they must drastic intervene. And we are having many stakeholders. The Ministry of Health is our stakeholder. Justice stakeholder, trade and industry stakeholder, and many, and even churches, they are taking advantage because they used to be blamed as before. Although we are Christian, I'm a Christian from Evangelical Lutheran Church. Yeah, or we are Christian, we are parents, we are human beings like others. We are not selling alcohol to damage and destroy our country. We don't have any other business to do. Since 2004, I'm just in that industry. But now, what should be done? We are all hijacked. The government is hijacked by COVID. We are devastated. We don't know what to do. We need more intervention of many stakeholders, like the doctor is saying. But let our people understand also that what is the government trying to do. We want to tell them that message. The government is trying to do everything fine for us, for Namibians, for all Namibians. Not because the leadership of who's leading the country now, maybe they want us to die. No. There is no such a thing. I don't believe it. But I don't know how to explain. I just quote myself. More intervention should be come.
Yeah. Do you, from the shebeens, your shebeen, for instance, and other shebeens that you know of, do you have hand sanitizers in your shebeens?
Everything, even a bucket of water when people come, yeah. When our workers touching money, quickly giving change, sanitizer again, go and wash. And we want also to be adhere to regulate our customers. If you are not doing ABC, like you come to my shebeen and you are not with your mask, you don't want to wash your hand, you don't want to do ABC, then you will not be allowed. We want to be our security ourselves at our premises. Otherwise, people, they will die. We will die. It's true, we understand, but there at the ground, we don't have even something to pay our school fee. I mean, our children's school fee, etc.
Yeah. Dr. Sukubi, I kind of want to ask, looking at how, okay, we are out of the third wave now, but we have seen cases sort of fluctuate over the last week or so. Have the way that everyday business is going now, the way that people are going on now, I'm sure you have been observing life outside of your office. Do you think that people are adhering to the regulations, and do you think it's enough to sort of prevent a sooner fourth wave from coming?
Thank you, Shelley. It's very difficult really to really observe people from the distance. However, from our point of view, it is easy to to see this as the cases are spreading or reducing. Okay, so we know that prevention is the simple measures that we have mentioned, that we keep on seeing, that we keep on seeing. So just masking, social distancing, sanitizers, or washing your hands with running water and soap. And then, of course, ventilation. So better ventilation in areas. So, the regulation has been relaxed, and people are going on with some form of normal life, doing business and so forth. However, more can still be done in terms of these simple measures. Okay, so I've seen certain places, few places that I've gone to, there's no hand sanitizers when you enter the place. So, and that is a big concern. We cannot afford to down our guards now because we are still not out of the woods, and really don't want to go back to the third wave, what happened. Almost everyone was affected really badly. So we don't want to go back there. So we still need to adhere to our basic COVID-19 preventative measures, as I've mentioned. So there are places that are not strictly doing that. So what I would say that those places, they need to enforce these regulations, and they need to make sure that people going into their places needs to put on their masks, and so that we can avoid people coming together who are not protected based on the measures.
Yeah. I'm not sure if you've seen the scenes from one of our local Bantu clubs, or nightclubs, in fact, where we saw numerous people congregating, no social distancing, no mask. Does that worry you if that trend continues?
Actually, that gives me goosebumps. We know that prevention is social distancing, wearing masks, and so forth. And places we have also heard of super spreaders and so forth. So a place like that, or the scene that we have all seen on social media. So if there is somebody out there who is highly contagious with SARS-CoV-2, so it is easily going to be spread. So we have seen there was no social distancing and there was no masking, so meaning that if there was somebody who will come out, a lot of people may get infected in there. And certain places like that one, ventilation is also low, which means that the viral particle may stay a little bit longer in the air, and then people around can inhale that, and that is a risk for further transmission. So no ventilation, no distancing, and no mask in that event. So that actually is a worry.
Yeah. And you're sort of speaking to the words of the minister here. I'll just read some of what he said when we did speak to him about the very same issue. Although he did say, yes, he is very, he doubts that will be social distancing, for instance, in bars. He did also say that when they make a decision, for instance, when the policymakers make or decide on the regulations, they consider potential loss of revenue. So sort of balancing that livelihood and lives scenario that we have. When you advise the policymakers, as you said, you are in that advisory role, do you consider that as well? Or is that for you just give the science of what the situation is and then they decide on the livelihoods and the lives scenario?
So yes, as you rightfully say, we are on advisory role, and we give the scientific evidence on how the virus is spread. And we are, even though we are in advisory role, we are also aware of the livelihood of people. That being said, we are also, aware of what devastating effect can come out in an event that you may say is a super spreader event. So that's why we, want to acknowledge the suffering that can come from both sides. So it's a big balance, and I mean it's a very tricky one to deal with. So that's why we also advise that if people get vaccinated, the earlier people get vaccinated. So I wouldn't get worried with a scene like that, because I know people are vaccinated, and even if somebody is very highly contagious in there, the risk of someone getting infection is highly reduced. And again, the risk of that person who was vaccinated or who is vaccinated of getting severe disease or critical disease and eventually dying is also really highly reduced. So it is a difficult one. However, we still stand by making sure that we don't get people unnecessarily engaging in highly risky behavior that may span into another wave.
Yeah. Thank you very much for joining us both, gentlemen. The minister said in the final analysis, and this is relating to the current regulations, he said that they allowed the 9 hours trading because they were trying to, balance the situation and not have people, congregate at one place where there's not enough ventilation, for instance. It seems like all roads lead to the vaccination sites, and just speaking towards it, perhaps maybe you guys amongst each other can maybe speak to having a vaccination campaign and then promoting that vaccination campaign. Have you been doing that? Have you guys been discussing that we all need to get vaccinated and promote that amongst ourselves when our customers come as well?
Yeah, thank you very much. We are ready, because if we get that mandate that we should communicate our people, you cannot stand and say, I'm representing you from your challenges, then you come, go vaccinated, go get vaccinated. Sometimes it causes chaos, because I quote myself, people, they don't understand. But if they hear the government give us that information, we can channel it to them. And I want to concur with the doctor now. Serious, if I walk around, many shebeens, they don't have sanitizer, they don't have bucket of water. And we will be there squeezing each other without wearing our mask, without doing anything. But if we have an option to take drastic step to us, ourselves, then they will understand. It's not by force, but they are forced by hunger and they are forced by the disease already. We are in a devastated situation. We must understand each other now. Because if I stand now, then the government say, you representing of your people, tell your people ABC, we need ABC because of whatever is going to be happen is dangerous to all of us. Then we will do. I concur with the doctor. The doctor is saying there is no mask, wearing of mask, bucket of water, sanitizers, and we ask ourselves, how do we operate? We can ask ourselves there on WhatsApp group, on whatever, on small meetings.
Yeah, so you do correct each other.
Yeah, we do correct each other. But it doesn't mean we don't want. So our people are, sometimes they are saying, you are talking, I'm running my own business. But you die from your own business as well. And you die from hunger, you die from COVID-19. So what I want to apply here, can we have that mandate to regulate our people together with the stakeholders to see how best we can assist? Because the same person the government need to help is the same person our association need to help. We cannot allow that you do your things alone. No. We are under regulation of the government always. We want to adhere there and we want to listen. But when it comes to that situation, what should we do? What should be done for ourselves and for our government? Remember, the government won't let you die, even from hunger, even from COVID-19. Then now, everything just came together. Freaking ourselves is where we stand. How can we get assistance? But if people, they don't want to understand, I'm not hiding to say, if you don't want to understand, then nothing we can say. The police can implement the law, They can come entering your shebeens and whatever, and you don't have anything. If you're going to be arrested, you can be arrested. If you because to kill yourself is like it's not different to be arrested by the law enforcement.
Yeah.
Our people are slowly understand that there's COVID-19 serious. They only sometimes understand that they are feeling hungry, but we have to consider both. Otherwise, you can die, you leave your kids there by COVID. You can die by hunger, you leave your kids. It's the same story. What we are looking and plead from the government is just modalities now. Because as I'm speaking, I'm at the ground. I used to walk there and there. I communicate with people. People are calling me because they know we've been representing them long ago. So, it's quite not nice.
Yeah.
Yes.
And that brings us to the end of our conversation. We were reflecting on how the shebeen economy can continue operating and help them make some kind of profit, as opposed to right now, where it is a bit difficult for them to do so. Dr. Sukubi therefore spoke about hand sanitizing, social distancing, wearing of masks, and how these little things can prevent the further spread of the COVID-19, and perhaps the vaccination can also therefore allow us to go back to what we knew as normal pre-COVID-19. Thank you very much for joining us, gentlemen. It has been an absolute pleasure. Please don't forget to comment underneath if you have any questions, and we will continue the conversation. It is goodbye from me.